Well, thank you so much, Daryl, for sharing that very powerful and deeply moving account of your experience with your wife. I feel like I have to take a breath after that. I wanted to, as Kay said earlier, I serve as the spiritual care coordinator at Hospicare, and I've been there for about 8.5 years right now. And I wanted to thank the League of Women Voters for holding this event. I think it's so important, especially in this day and age where we're so polarized in our society, to have times when people come together from a variety of perspectives and discuss issues, in an open way where we, listen and learn and respect one another. So thank you for making this happen. I also want to acknowledge the presence of Dr. Suzanne Anderson here with us this evening. Suzanne, can you stand up and wave a little bit? Suzanne is a dear colleague. She serves as the medical director at Hospicare. She is a palliative care physician and a tremendous resource of wisdom and experience for us on this topic. So we're very fortunate to have Suzanne with us here tonight, and very fortunate to have her with us in our community, serving those of us who live in Tompkins County. As the Blackfoot saying put it, what is life? It is the flash of a firefly in the night. It is the breath of a buffalo in the wintertime. It is the shadow which runs across the grass and loses itself in the sunset. As we all know, life is very fleeting. Nonetheless, we matter. Our lives matter. And how we make meaning out of our life and our death, both as individuals and as a community, is an issue of utmost importance to us as human beings. As we as a society grapple with our beliefs about the value of life and what constitutes a meaningful death with dignity, and we seek to craft legislation which supports those beliefs and values, what guidance and insights do our faith traditions offer us? My intent this evening is to speak about some of the reasons which religious groups have espoused both to support and to oppose physician-assisted death, to sort of give two sides of the story from religious perspectives. In my remarks, I'll be drawing primarily from Unitarian Universalist and from Roman Catholic sources, since I'm most familiar with these two traditions, and I think they represent, well, like the two ends of the spectrum of religious attitudes towards physician-assisted death. In 1988, the Unitarian Universalist Association General Assembly became the first major denomination to pass a resolution supporting the right of terminally ill patients to select the time of their own deaths. Their resolution reads, "Guided by our belief as Unitarian Universalists that human life has inherent dignity which may be compromised when life is extended beyond the will or ability of a person to sustain that dignity, and believing that it is every person's inviolable right to determine in advance the course of action to be taken in the event that there is no reasonable expectation of recovery from extreme physical or mental disability, be it further resolved that Unitarian Universalists advocate the right to self-determination in dying and the release from civil or criminal penalties of those who, under proper safeguards, act to honor the right of terminally ill patients to select the time of their own deaths. So that was way back in 1988. In 2016, the interfaith group called Interfaith Impact of New York State issued a position paper in support of medical aid in dying. Their president is a Unitarian Universalist minister. He's someone who actually served as a pastor here at the First Unitarian Church a number of years ago and is well known to perhaps many people in this room. Their president is Reverend Richard Dick Gilbert, who's now, I think, in his early 80s. Dick Gilbert wrote a background paper delineating the moral principles behind support for physician assistance in death. And I just wanted to share with you some of what he wrote and the principles that he highlighted in his statement. The first principle is the reverence for life. And here the concept of reverence for life doesn't so much refer to biological existence as it does to the quality of human living, to our relationships with others, our relationships with nature, to our ability to create something out of our lives that is meaningful. Life, he says, is more qualitative than quantitative, and there's no inherent value in longevity in and of itself. So sometimes the greatest reverence for life is to end human suffering and the anguish of those who love those who are dying. The second principle he highlights is self-determination or freedom. The UUA position on end-of-life issues is grounded in the Church's teaching on the sanctity and the integrity of the individual conscience and the conviction that ultimate questions of life and death belong with the person who's most intimately affected by those decisions, not with a church or a legislative committee or a bureaucratic panel. The third principle is the meaning and quality of life. He acknowledges that various religious bodies have differing views on what constitutes the meaning of life and how the quality of life relates to simple longevity. But he asserts the UU affirmation that it is the quality of life, not the mere prolongation of biological life, that is most decisive. And lastly, he talks about the slippery slope moral argument and makes his case against that. He says, some fear that if we practice euthanasia, the moral climate will be so polluted that no one will be safe, and we will become another Nazi Germany. In response to that, Gilbert states, to raise up the specter of Nazi Germany is ludicrous. The genocide practiced by Hitler was not based on the self-determination of the victims. It was a merciless extermination of people. We advocate medical aid in dying, supported by law which would maximize one's self-determination. We affirm the right to die with dignity, the last right of any human being. And now let's take a look at another religious perspective, that of the Roman Catholic Church. In 1991, the United States Council of Catholic Bishops issued a statement on euthanasia. It reads, in part, "As Catholic leaders and moral teachers, we believe that life is the most basic gift of a loving God, a gift over which we have stewardship, but not absolute dominion. Our tradition declaring a moral obligation to care for our own life and health and to seek such care from others recognizes that we are not morally obligated to use all available medical procedures in every set of circumstances, but that tradition clearly and strongly affirms that as a reasonable, responsible steward of life, one must never directly intend to cause one's own death or the death of an innocent victim by action or omission." On the website of the United States Catholic Conference, they posted a list of reasons that they are opposed to physician-assisted suicide, as they call it on their website. First of all, they say it is dangerous in our profit-driven healthcare system to legislate such a thing. Some patients in Oregon have received word from the Oregon Health Plan. They say that it will pay for physician-assisted dying, but will not pay for treatment that may sustain their lives. And in 1998, a study from Georgetown University's Center for Clinical Bioethics warns that there must be a sobering degree of caution in legalizing assisted death in a medical care environment that is characterized by increasing pressure on physicians to control the cost of care. Secondly, the bishops hold that physician-assisted death may put vulnerable people at risk of abuse. Once lethal drugs have been prescribed, assisted suicide laws have no requirements for assessing the patient's consent, competency, or voluntariness. They say that elder abuse, since it is considered a major health problem in the United States, the government estimates that 1 in 10 elder persons are abused, and placing legal drugs into the hands of potential abusers generates a major risk to elder persons. Thirdly, they note that terminal illness is defined too broadly, and that predictions of life expectancy may be grossly inaccurate. I think we all know that. We've all heard stories of people who've been told they're going to live 3 months and they've lived 3 years and so on. They say that laws typically appear to limit eligibility to terminally ill patients who are expected to die within 6 months, as Darrell said, but they don't distinguish between persons who die with 6 months having had treatment and those who will die with 6 months without treatment. Furthermore, as we know, the diagnosis of terminal illness and the predictions of life expectancy are very often inaccurate. The bishops assert that being a burden is among the top reasons for taking lethal drugs, and they state that that is not a justifiable reason for taking one's life. According to official annual reports, in 2016, 49% of Oregon patients seeking lethal drugs cited being a burden on family, friends, or caregivers, and in Washington, 52% cited being a burden. And lastly, they note that physician-assisted death threatens improved palliative care, There's compelling evidence that legalizing assisted suicide undermines efforts to maintain and improve good care conditions for patients nearing the end of life. Vermont legalized physician-assisted death in 2013, and by 2015, the state had the third lowest hospice utilization rate in the nation. Lots of points to consider. I wanted to end just with a quote from a statement which the United States Conference of Catholic Bishops issued in 2011. It was their statement on physician-assisted suicide, and it's entitled, "To Live Each Day with Dignity." And here is an excerpt from that statement. Our society should embrace a readiness to surround patients with love, support, and companionship, providing the assistance needed to ease their physical, emotional, and spiritual suffering. This approach must be anchored in unconditional respect for their human dignity, beginning with respect for the inherent value of their lives. Effective palliative care allows patients to devote their attention to unfinished business in their lives, to arrive at a sense of peace with God, with loved ones, and with themselves. No one should dismiss this time as useless or meaningless. Learning how to face this last stage of our earthly lives is one of the most important and meaningful things each of us will do. And caregivers who help people through this process are also doing enormously important work.